And that is the proposed enormous changes to the NHS in England. It's the government publishing its Health and Social Care Bill, a series of changes, but the essence, what we keep talking about, is that family doctors, GPs, will take control of most of the budget, about £80 billion. This is England only, of course. The plans don't affect Scotland, Wales or Northern Ireland. Let's talk, though, to Dr. Peter Swinyard. He's the chairman of the Family Doctor Association. Good afternoon to you. Thanks for waiting to speak to us. I know you've been patiently listening to that debate in the Commons as well.
Fascinating, isn't it? Yes.
Well, in terms of these proposed changes to the NHS in England, I don't know how many years you've been a GP for, but I'm curious to start from the vantage point of, do you feel, with your experience, that change is needed, that the demands on the NHS are such now that there has to be some scale of change?
Yes, I do. I've been a GP for 26 years now in Swindon, and we've been going through changes ever since I joined in general practice. But I think that the system has gone stale, and that the administrative obfuscation which we've been struggling with has got to be changed. There have been various attempts at getting local commissioning in the past few years, but on the whole they have not worked to the patient's benefit. And I think there has to be a complete change of system to make it work better. And the point of this new system is it isn't going to be just GPs telling people what to do. It is going to be GPs and other clinicians working together to make good pathways for patient care. And it is going to be the GP commissioning consortia working with their patient populations, with public health doctors, and with the elected local representatives in councils to plan health care to get the best possible value for money for patients.
You will know that part of the patient concern here is perhaps, let's say a patient comes to you in the normal way for a GP appointment, it's getting towards the end of the financial year, budgets are tight. Is that patient going to come with some anxiety that whatever they need a referral for, you, the GP, may be less inclined to make that referral simply because of bad timing, it's the end of the year, money's tight? Is that a realistic prospect?
I hope that never happens.
Well, you hope it doesn't, but everyone hopes it doesn't.
I would go much more strongly than that. The GP's first responsibility is the patient sitting with him. And we will always remember that the patient is the most important person in the whole health service. And I fully take your point about budgets being tight, end of year pressures and so on. We have that now under the existing system. I had patients coming to see me in my surgery this morning saying, well, I'm due for a hip operation, but I'm told they're not doing any till April because they've done too many this year. Well, we will always have pressures of time and numbers, but with the new system, at least the patient voice will be heard in planning healthcare and healthcare volumes, and in making the difficult choices we will always have to make when we have a limited healthcare budget and an ever-expanding demand.
And will there be some GPs who will feel daunted by this, who do think, actually, the main reason I spent many years training is because I want to help people, not because I want to run a small business?
Yes, no, you're absolutely right. Mind you, GPs all do run small businesses because we run our practices and we don't have a penny of salary. Unless we actually run our practices well, we don't make a living. So I think we are all used to a business model. However, not all GPs will be intimately involved in the commissioning process. There will be elected consortia of GPs, which will be led by a few GPs who are good at medical management and good at administration. And the time that they would have spent on clinical care otherwise will be backfilled into their practices with sessional doctors and locums so that the patients always have a good service from their local GP practice. And the majority of GPs will be supporters, not necessarily leaders of the system.
All right, as a quick final thought, would you be prepared to hazard a guess as to how many years after this comes in, patients will truly start to feel or see a benefit?
I think that it'll take, well, the whole system comes into play in 2013 if the timetable is followed. I think it'll be a year and a half beyond that before we see some real changes in the pathways for patient care. But there will be some changes before then as well, because the shadow consortia will be working with the present primary care trusts to try and provide a better and more clinically led system of health care.
Interesting. Thank you very much for your time. We'll talk again, I'm sure. Dr. Peter Swinyard, who is chairman of the Family Doctor Association.